Yes, hopefully everyone can see my screen. Great. Yeah. So you all must be thinking, what about that title? So well, I recently became a father, and so I figured that saliva can be charming in some ways. So this is the reason why I wanted to pick this title myself. And I guess I also figured that most of the folks on this call are pretty much convinced of the charms or the good aspects of saliva and saliva-based diagnostics. And so my talk will probably be a bit different from some others that you've had here on this series, because I am not doing active research anymore myself, but as a research consulting firm, PreScouter is working with clients in biotech and healthcare to look at diagnostic innovation. So I'll just give you my personal take on saliva diagnostics and where it's heading, and highlight some challenges in advancing it. So as I said, I'm probably preaching a bit to the choir here. And so I think we can all agree on all kinds of different benefits that saliva brings with it, right? I think this is just a handful of the ones that I could have highlighted. But in particular, maybe good to think about it not only from an infectious disease perspective, but also from drugs of abuse testing, or companies doing sort of suspicion testing. It can be done remotely or at a distant location, can be done on site. One thing that comes up quite frequently is also age and disability friendliness, right? So folks that cannot produce blood samples, or maybe it's difficult to get them in a certain location of care. And that's really where saliva has a lot of its power. So I think we can all agree on most of these things. I think also a lot of folks here on the call will know that it's not a magic bullet for all disease areas or diagnostic needs. So as much as we would want that in some cases, it's not. So I think there's also really good use cases, right? I figured, and this is a slide that I actually stole from one of our white papers at PreScouter, is highlighting that there's really, really good use cases for saliva and how powerful it can be in diagnostic routines. And probably a lot of you will be familiar with this, but the work done from the Yale group, not only Saliva Direct, but also looking at pooled saliva sampling, really made a big case during the pandemic for saliva and pushed things forward. On the other hand, for over 2 decades, people have been using saliva for drugs of abuse testing. So life insurance companies, there's construction companies, they're using this already for quite a while. And so it's rather successful there. And so this is another good example of a use case where, the saliva samples have a similar window of detection for drugs of abuse as blood. And I put that on the left side here of this graph, while of course having the benefits of being non-invasive. And then on the right, just a quick glance at the SAMHSA-5 panel. I don't know how many of you are familiar with that, but the most popular drugs as part of that panel, you can see that the sensitivity compared to urine, which is the gold standard, is actually quite good. And so this is not a small sample size. This is actually a collection of over 4 million oral fluid sample specimens and about 30 million urine specimens. So pretty convincing data. So I think it's the way I think about these things is coming from an academic perspective, but being now in a commercial environment, is there's really good use cases for saliva and saliva diagnostics. And how has that affected the total market or market share? And so what I'm showing you here is the global diagnostics market for saliva-based diagnostics for 2021, which is the latest data points that we have, and 2026 projected forward in terms of how big that market is. On the left side, y-axis in billions of dollars, US dollar, and the growth rate. You can see that infectious disease is really the big chunk there. It's kind of declining quite rapidly because of, fortunately, the pandemic slowly fading out. And there's some other areas where saliva is actively being used. One thing to note, though, and I don't know how many of you are familiar with these kinds of growth rates plots, but the growth rates are not that staggering. They're quite low, actually, if you compare it to other areas of innovation. And so one question that you may ask is, why is that the case, right? There's these really good use cases. There's this really strong push from the pandemic to use saliva, but it doesn't seem to be translating, at least in some of these market numbers. So what is holding back more rapid uptake of saliva-based diagnostics. We have all these benefits, right? And beautiful use cases, good push. But why is it not translating into anything sizable now? Well, I would argue that if you look at the average diagnostic development timeline, and this is just estimates, of course, there's all kinds of different variations here, but it's a long process to get all the way from an academic invention to a small company working out the commercial assay or device or method to integration into regulatory guidelines and clinical guidelines all the way on the right. So you can see this is a span of about 12 years. And I would argue that for saliva, we are actually in the area where innovative companies are planting seeds, are building assays, devices, overcoming technical challenges. And therefore, there's not really been this large market adoption yet. We're still at that nascent stage where it's gaining traction, it's gaining attention, it's gaining popularity. And arguably, once some of these assays make it all the way through, and some already have, there's going to be a positive feedback loop into academic research, innovations in startups, and also interest, funding, decreased resistance, right? Which will sort of condense some of these timelines, and it will become really a positive feedback loop. So one of the other reasons is, to be really fair, blood-based diagnostics had a sort of a head start. Saliva has had a bit of a slower pace, less traction, less funding for basic research. And this plot shows here in red the number of publications for blood diagnostics, and then in blue, those for saliva. And mind you, this is not a normal scale. This is a log scale on the left side, y-axis. So this is a very big discrepancy between the number of publications that are coming out of blood-based diagnostics and saliva. And so obviously, that means that there's less inventions coming out of academia, there's less interest, less funding. And so the change that we've seen recently is that if you look at the saliva diagnostics compared to blood, which had about a 7% growth in publications over time, saliva has really picked up pace in the last years, and especially during the times of the pandemic. And so this is really emphasizing that we're at that front end of innovation, and it's fueling all kinds of startups, ideas, and overcoming technological challenges. So at PreScouter, I think we have interviewed about 100 different experts on saliva-based diagnostics from all kinds of different angles. So clinicians, clinical labs, big biotech companies. And these are just some of the common concerns, I would say, from stakeholders that they have on saliva and saliva-based diagnostics. So clinicians are worried about an inferior performance, lower sensitivity, those kinds of things, limited clinical value. They find it difficult to change routine if they have blood-based draws and those kinds of things. And they're worried about reimbursement. Is this going to be covered? Can I use this? Is it going to be out of pocket? Clinical labs have other kinds of concerns, which are around transporting saliva samples to their lab. Difficult sample handling, viscosity, low sensitivity, specificity, and therefore maybe a limited market value. And for the big biotech, it's kind of similar. They're looking at these point-of-care devices. They're thinking about saliva, and they are under the presumption that the sample prep is going to be impossible. It's a difficult regulatory path, low sensitivity, specificity, and again, limited market value. And I want to emphasize that these are preconceived notions that stakeholders have around saliva that are not all fact-based. These are things that people have ingrained in their brains that are not always supported by data. And still, this is what you're battling against in sort of leading that innovation. So one of the problems there is really a lack of education, I would say, at the diagnostic developer level, which means if you look at this plot, this is simply looking at if you measure in blood, saliva, or urine, indicated with the different colors, the concentration of analytes on the x-axis. How do they compare, right? Because the worry is the sensitivity is going to be low. There's no analytes available in saliva. But if you look at this plot, there is a really good tracking of concentration in saliva and blood in most cases. And in some cases, there's even more present in saliva. So that's the blue side on the right side. So that conception or that preconceived notion of that it's not going to make it is not always based on facts. And making these kinds of overviews and education of diagnostic developers can overcome some of those issues. So who are then driving the adoption of saliva-based diagnostics, and who are going to push that growth number up, right? Who are the key stakeholders, so to say? Well, I think the classic answer everyone always gets is, well, it depends, right? So I'm going to say the same. Well, it depends. It depends on whether you're looking at disease diagnostics for patients or consumer diagnostics, right? Those are two very different sort of games that you can play in as a diagnostic developer. And the patient side, there's different stakeholders. There's the clinician, there's the patient, and there's the hospital or clinical lab. And on the consumer side of the diagnostics, you have the consumer and the commercial lab. So very different stakeholder profile. And then if you think about, pushing saliva or driving the choice for saliva-based diagnostics, from the clinical side of the equation and in disease diagnostics, it's not really the patient that's driving the choice for diagnostic. It's the clinician. They're saying, well, you're going to get a blood test and it's going to happen. And so, while a lot of things around patient experience are important in that diagnostic workflow, right? Like ease of use, easy to give a sample, non-invasive, it's really nice. But in this case, the clinician calls the shots. So, and they base those decisions, of course, on regulatory and clinical guidelines that outline standards of diagnostic care. And within those, there's non-inferiority information, scientific validation to sort of get those on the agenda, to get them into the clinical guidelines. And things like ease of use, patient experience, and time to result, they weigh in it too, but to a lesser extent. For the consumer experience is largely driving the adoption of diagnostics, right? Imagine 23andMe giving you the choice of sending you a needle for a blood sample and a small tube, or a saliva kit, right? It's quite easy to think about what's going to drive the most beneficial patient experience. And so for wellness testing, genetic testing, consumer testing, there's a really much more direct relationship between usability features and those benefits and driving saliva innovation. And historically, the clinical labs that were involved, they have pulled back some of the innovation on saliva. But much more recently, we've noticed that CRL, LabCorp, Quest, they're all converting their assays to saliva because they are overcoming technical challenges. And really, all those smaller labs are knocking on the door and getting their revenue. And so they're forced to switch. So what's sort of holding back, I guess, that drive? Why are those CAGRs so low? Well, you probably know about the valley of death for pharma products. I would say there's the diagnostics grim reaper for diagnostics, and this is something I came up with myself. So please don't think that this is an actual thing. But really, to say that the point at which an innovative company has a great idea and an assay that works, or a pilot, to then go to clinical validation and regulatory approval, there's a huge amount of money required, and that is driven, of course, by interest from biotech companies or diagnostic companies, but also a pushing force from regulatory guidelines. And I think one good example is the drugs of abuse testing, where the regulatory guidelines have changed. And so now everyone thinks, oh boy, we're going to have to go into oral fluids, right? So to overcome that sort of valley of death for diagnostics, and to pass the diagnostics grim reaper, you have to get those stakeholders on the right side of the equation on board. Well, I have some good news. I think the wheels are definitely in motion here. The momentum is definitely there. And so these are some of the concerns I mentioned, right, from the stakeholders. I just want to call those out again. And a lot of innovators are tackling some of those challenges, right? So those perceptions, they may have been true 5 years ago, but they're no longer true. And so I think that's something to keep in mind, is that there's all these different companies, Saliva Direct included, right, pushing the frontier of science and innovation into practice and overcoming these challenges, and convincing clinical labs and others that this is something that's possible. And on the right side, I have some Illumina 5DX and Auris DX. They're working on oncology screening for saliva. And then another good element is that, as I said, the federal guidelines have changed for drugs of abuse testing, Department of Transport testing. And so regulatory guidelines are adopting oral fluids. And so a lot of the companies that are offering these testing services, companies like Abbott, they all of a sudden are sort of forced to go along with oral fluid development and oral fluid assays. So I think that's another very promising sign that this is going to move along and going to go into a snowball effect for saliva adoption. And then I guess this is just based on some of the research we did at PreScouter is what are some of those shorter term activities that companies are developing for saliva-based diagnostics, well, sequencing, ancestry, infectious disease testing, wellness, but on the longer term, really drugs of abuse at a high scale, like a very high scale testing, and then oncology as well. So there's a lot of interest from large commercial clinical labs, which is also great. So again, pushing that wheel forward. Okay, so what did I tell you? So things are moving at a snail pace, but it's completely normal. Innovation takes time, and it's definitely happening. And what is important, I guess, is lobbying, right? Making sure that you convince big biotech, regulatory folks at the early stage of development to understand, how can we make that connection much more seamless? And so what we've done at PreScouter is also help our clients understand how to drive adoption of their technologies by looking on how you can convince regulatory bodies, what kinds of policy documents are there, identifying partner patient organizations or clinical associations to integrate saliva-based diagnostics, thereby pulling the clinicians on board because they're following the guidelines. And then also by providing educational materials for all kinds of different stakeholders. And with that, thank you for inviting me. It was really nice to receive this invite. I hope you enjoyed my chat, and I'm happy to contact you beyond this meeting. So feel free to shoot me an email or add me on LinkedIn.